Let's say you roll your ankle, you're still able to put some weight to it, but it hurts. You don't necessarily have to go rushing to an urgent care or to the emergency department. The old adage of rest, ice, compression, and elevation, RICE protocol still stands true. So obviously with most bone, joint, ligamentous injuries, tendon injuries, strains and sprains, you want to actually add ice in the acute setting. If it's a muscle strain, sometimes it can respond fairly well to heat, but most of the time what we end up seeing is more so sprains and strains. So icing it up, 15 minutes on, 30 minutes off, repeat numerous times throughout the day. Staying off of it, obviously, the rest is a big part of it. Compression, if you notice that you're swelling a whole lot, you can actually apply a lightly compressive ACE bandage. You don't want to strangulate your lower extremity. It's important to still maintain blood supply because again, blood helps healing. And then obviously elevate, pop that sucker up. Make sure that you're getting all that good blood flow coming back so you're not sitting there swelling, because most of the time it's the swelling that ends up hurting the most.